Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And November is Diabetes Awareness Month. So in honor of the month and to get you all aware of what's going on in health and healthcare, I'm joined by a great guest, Kathy Winslow. Hi, Kathy.
Hi, Jane. How are you?
I'm doing well. Thanks so much for coming on the show.
Thank you for having me.
So we invited you on here because you are a coordinator. Well, you can tell me, what do you do?
So I happen to be the Diabetes Education Coordinator for Southern New Hampshire Health.
Okay, so that's great, and that we'll talk all about what you do. We do want to learn a lot about diabetes during this segment because it is a really important condition to understand. Type 2 diabetes, for example, is a preventable condition, I should say. And so in public health, we always look for prevention and what we can do for prevention. So diabetes is right up there. And I will also just add, as way of introduction, that our Community Health Improvement Plan that the division has the privilege of spearheading for the Greater Nashua Public Health Region has landed on diabetes as a chronic condition that really needs to be addressed as a community. And so we will try to do that through our public health initiatives. So it's very exciting to have you here. And so, just explain to the lay person, what is diabetes?
So I am so glad that we're focusing on diabetes, and I'm so happy that Nashua has chosen this chronic condition to really focus on. Diabetes affects so many people in our community. It's really a problem of glucose metabolism, and having the higher glucoses damages many of the systems throughout the whole body and can lead to more illness and challenges with life.
So when you say glucose, is that sugar, or what does that mean?
So I use glucose. It's a term for sugar. So we often will hear people talk about blood sugar. I also interchange it with blood glucose.
Okay. So it's a disease of?
So it's a disease where the body has a difficult time keeping the blood sugar, the blood glucose, in the normal acceptable range.
Okay. So just for the lay, there are
Sure.
2 types of diabetes.
There are.
Well, there might be 3, because I don't know if gestational diabetes is considered a third, but we'll get there.
We'll get there.
So we have type 1 and we have type 2.
Correct.
So a quick and easy way to understand the difference?
So type 1, people who have type 1 diabetes do not make insulin, whereas type 2 diabetes, they're still making some of their own insulin, but their body is having a harder time using it, a condition we refer to as insulin resistance.
Oh, interesting. I really was looking that up, and I thought, I don't understand the difference between the 2. So type 1, no insulin in the body.
No insulin. They need to replace the insulin that their body's not making with injectable insulin.
Okay.
And type 2 diabetes, we manage it with a lot of healthy eating, being physically active. Many people use medications, both oral and injectable medications.
So very interesting. And so in public health, I'm not sure how much we can do about type 1 diabetes.
Yep.
It seems to be, it's not genetic from what I understand, but is there anything that is a risk factor for type 1 diabetes?
There is some genetic risk predisposition, but you're right. Type 2 diabetes is really what we focus on in public health, that there's a lot that we as a community can do to lower our risk of developing diabetes.
Okay. So before we get to what we can do,
Sure.
you mentioned a little bit about some of the things that can happen to your body as a result of having the condition. And so I was looking up, of course, some complications. They're not always in plain written English, so maybe we could go through some of these complications.
Sure.
Not to scare people, but just for people to realize that this is really something you need to pay attention to, because the long-term effects of living with this condition can really be devastating. So first, we have neuropathy.
That's correct. So unfortunately, the higher glucoses can affect the nerves throughout the body, that they may not carry their messages to the body and then back the way that they should. We find that the nerves that tend to be affected first are the longest ones of the body, so the ones that go from our head down to our feet. So that's why, unfortunately, we're very concerned about feet with people with diabetes.
Oh, that makes sense. Wow. Okay, so the ones that are further away
Are more
tend to
susceptible.
give you, so because when you see neuropathy, it also says like foot issues, complications.
Correct.
Is that a painful condition, or is it?
So neuropathy often starts out as, people will describe it to me as like a numbness, a tingling sensation. And then often over time, it does become worse. It does become more painful, and people are very uncomfortable with it. Where it really scares me is when people suddenly tell me, oh, my feet don't hurt anymore, that I go, oh no, now you don't have sensation in your feet, and now you're more likely to injure yourself. And if you injure your foot, it may not heal as well as we want it to because of the diabetes.
Okay. Yeah, is there something with also any kind of like scar, other kind of injuries, like if people scar easily, or?
So
is that...
people with diabetes, if they get like a simple cut on their hand, they often will notice that it doesn't heal as easily, because when our glucoses are higher, our blood sugars are higher, it's more difficult for our immune system to fight that infection. So that is why people with diabetes often have slower wound healing. And we're sometimes very concerned about that. If somebody needs a routine surgical procedure, we might have to say, you know, this is something that you would like to have done, and it has to wait until your blood glucose levels are in better control so that your body's able to heal after the procedure.
Makes perfect sense.
Yeah, it does, but sometimes that's hard to wait if you really want to have something done.
So that would be under skin complications, and then we have eye complications like glaucoma and cataracts.
So glaucoma and cataracts are more common in people with diabetes. The other complication we're very concerned about is the high sugars, the high glucoses in the eyes can damage the little blood vessels, and that can actually lead to blindness if we don't take care of it. So it's very important for people with diabetes to see an eye care professional every year for a dilation to look at the health of those blood vessels in the back of the eye.
There's a lot to do, so this is why we want to avoid this if
There's
at all
a lot
possible.
to do with diabetes.
And we also have kidney disease. So how does that occur?
So again, the higher glucoses affect the kidney's ability to filter the blood, and unfortunately, people with diabetes can end up needing dialysis, transplants, because their body's not able to filter their blood.
And then the final thing, which is really just a point of fact, is that those with diabetes are at 2 times the risk for stroke and heart disease.
And I always talk with people that I'm working with about how heart disease is the big thing that I'm very concerned about, that people with diabetes have more heart attacks, they have more strokes, that we're really trying to prevent heart disease, that's a major complication of diabetes, uncontrolled diabetes.
Uncontrolled. And what about hypertension or high blood pressure? Does that, are you at more risk for hypertension if you have diabetes, or is it just another thing you need to monitor?
So there often is a higher incidence of hypertension in people with diabetes. So when we're talking about complication risk reduction, I always talk about the ABCs. We talk about, I'm sorry, I might be getting ahead a little bit.
No, that's okay.
But we talk about A1C, which is a measure of glucose, so measuring the glucose level. We talk about B for blood pressure, and we talk about C for cholesterol, because many folks who have diabetes have problems with all three, and we're trying to reduce the risk of complications.
Okay, so you only got ahead on one. I
Sorry.
knew the A and the C, so.
Sorry.
I mean, you got ahead on the A, but not the B and the C. Because I was going to ask you, so, well, I have a lot of questions. So, so as far as diagnosing diabetes, you know, you talked, first year A was A1C. And so can you just describe what that test means?
So, can I actually start with one of the simpler tests
Sure,
that we do
absolutely.
for monitoring to screen for diabetes? That often the test that we'll do is what we call a fasting glucose level, where a person doesn't eat anything, usually for about 8 hours. They go to the lab, we draw their blood, and a normal fasting glucose is below 100. If their glucose is above 126, we say that person has diabetes. So that's one of the ways we can diagnose diabetes. Another way we can diagnose it is using a test called an A1C. What an A1C measures is how much sugar is kind of stuck, or we call it glycosylated, to the red blood cells. So by measuring how much sugar is stuck to the red blood cells, we can get an idea of what the average glucose has been over the past about 3 months. A normal A1C is below 5.7. We diagnose a person as having diabetes if their glucose is above, if their A1C is above 6.5%. And the third way that we diagnose diabetes, you don't see it, well, you still see it. We can do an oral glucose tolerance test where we'll have someone come to the hospital and we'll give them a drink that's very sweet and has about 75 grams of glucose in it, and then we check their glucose about 2 hours later, and if that number is over 200, or if they have a side effect, or if they have a symptom of high glucoses, then we can diagnose diabetes. And some of the common symptoms that a person does have high glucoses is they tell me how tired they are. They tell me how thirsty they are. They tell me how they have to go to the bathroom to urinate frequently. They might notice those cuts that aren't healing as quickly. They might even notice a little bit of blurry vision. With diabetes, though, not everybody gets symptoms of high glucose. So just because a person doesn't feel bad doesn't mean they don't have diabetes. So we really do rely heavily on those blood tests to kind of tell us, how is this person doing? Do they have diabetes?
So is there a certain age? I mean, you know, there are certain risk factors, but, you know, obviously, and we'll talk about those, you know, but is there a certain age where your doctor's going to say, you know, you've hit this age. I'm speaking from experience here.
Sure.
You should have this blood test.
So I did look that up, and according to the American Diabetes Association, it's 45 that we should start, you know, the routine screenings. But I always say to people, we don't wait for a certain age, that if a person has risk factors, we should do the blood test sooner.
Sure. And one of the biggest, well, I don't want to get ahead of myself, but we do have this great graphic, which is the road to type 2 diabetes.
Sure.
And it just talks a little bit also about pre-diabetes. So what does that mean?
So pre-diabetes is this time when a person's glucoses are not what we consider normal, but they're also not high enough to say this person has diabetes. I always think of it as kind of a warning, a call to action that this particular person is at very high risk of developing diabetes. There's a lot that we can do with people who have pre-diabetes to hopefully prevent the development of diabetes. And it's some of those lifestyle changes, those healthy behaviors, such as increasing your physical activity. I love to see everybody getting 150 minutes of exercise activity every week. So that's a 30-minute walk at least 5 days a week. Also, weight loss can really help a person who has prediabetes sort of change the course so that they hopefully don't develop diabetes. So, and it doesn't take a lot of weight. We often talk about 5-7% weight loss. So for many people, that's 10 to 20 pounds. It's not a huge amount of weight, but it can certainly reduce the development of type 2 diabetes.
Right. You don't need to go on The Biggest Loser
No,
and lose half your body.
No.
You need to make a change, a commitment to, like you said, that 30-minute walk a day, getting out on your lunch hour, you know, go around the block, even if you have to break up the 30 minutes and do it throughout the day. Just, you know, move, get your heart pumping a little bit. I always try to get my 30 minutes in also.
I do too. And of course, making healthier food choices that I always think about, that healthy, balanced plate, trying to have, you know, aiming for that half a plate of healthy vegetables every meal, having a little bit of protein, having a little bit of a starch at meals.
Yeah, just a little bit of a start.
Little bit, smaller portions.
Yeah, portions are like, it's amazing. Like, if you can eat the right things, but you still have to watch your portions.
You've got to watch the portions, that we can eat very healthy foods and still be a little heavier than we want to be.
So one thing you did, again, as in my studies to become a public health expert on diabetes, that type 2 diabetes is actually rising in our young people.
It is.
And so that's really, to me, kind of scary. So any tips for our young people? It says here 1 in 5 have prediabetes, and 1 in 4 from 19 to 34. That's 25% of the people in that age group. That's incredible.
It is. That even in my career, I've seen it, that it used to be that I didn't meet people with diabetes until their 40s, 50s, and 60s. I meet a lot of teenagers, 20s, 30-year-olds now. So the big things that I encourage our young people to do are the same things I encourage all of us to do. To move more, to eat healthy, to maintain that healthy body weight.
Absolutely. And so you did mention how to decrease the risk. So tell me, you head up the diabetes prevention program. So let's talk a little bit about your program and who your target is for that.
Sure. So we have a CDC approved diabetes prevention program. And our diabetes prevention program is a year-long program where we work with people to help make healthier changes in their life. The first 6 months of the program were pretty intense, that we meet weekly for about 16 weeks, right in a row. Sometimes it changes a little depending on the holiday seasons, but you know, we certainly aim to meet weekly for the first 16 weeks. And we talk a lot about how can we change some of our behaviors? How can we increase our physical activity? How can we make healthier food choices? And hopefully doing those two things are going to help us to lose 5 to 7% of our body weight. The second half of the program, the next 6 months, we talk about supporting each other, continuing to maintain those healthy behaviors. But we know behavior change is so difficult to do. So we focus on support. And sometimes we have these great intentions that, you know, we're going to go for that walk every day. Well, we live in New England. It's starting to get a little colder. Maybe it's going to be a little icier. Well, how am I going to go for my walk if the weather's not so nice? And we come up with some strategies of what else could we do.
So 16 weeks, very intense.
Very intense,
And
those
then
first 16 weeks.
But you do go the full year, because I think to make any kind of behavior change, you really do need that consistency.
You need that consistency, you need that support. So our diabetes prevention program has a trained health coach that guides people through the program over the year. And we try to individualize it as much as we possibly can. And one of the fun things about our diabetes prevention program is people start to share their ideas, that someone might have tried this wonderful recipe that uses this vegetable, and they might bring that recipe to the group and share it with everybody else. And there are a lot of friendships that form in our diabetes prevention program.
That's nice. So it's kind of a support group in some ways, which is really important for chronic disease.
So important for chronic disease, yes.
And so how does one get referred to your program? Do they have to have diabetes or type 2 diabetes, or are they pre-diabetic, or how does that work?
So we actually have two different programs, if you will. So we have our diabetes prevention program, and you can actually take a risk test and self-refer. Certainly we have many referrals from primary care providers in the community, but we also have a lot of self-referrals that the CDC has a risk test. It's a 7-question risk test, and if you score 5 or more points on this test, we consider you a person with prediabetes, and then you could take our diabetes prevention program. We also offer comprehensive individual and group sessions for people who already might have type 2 diabetes to help them better manage their diabetes. We also work with people with type 1 diabetes. We work with women who have gestational diabetes. So we meet people where they are through a combination, usually seen by both registered nurses and registered dietitians. And most of us in our office are certified diabetes care and education specialists.
Wow. So I'm just fascinated by this because, it's so important. And I actually, of course, had to do my screening. I will not be coming to your program yet. I shouldn't say yet, anytime soon.
Okay.
But I didn't do it through the CDC. I did with the American Diabetes Association, which, by the way, has some terrific resources as well.
Love the American Diabetes Association
website. Yeah, they really
website.
do. Very easy to use. You can check your BMI. I was having a good old time this morning.
Good.
Just trying to figure out what some of the risk factors are. And I think the big thing is, for lack, and I'm not going to be politically correct, but if you tend to be overweight, this is one of the biggest risk factors for diabetes, for type 2 diabetes. So, take that test. Check your numbers. We talk about primary care visits. Visit your doctor. Make sure you have that annual exam, especially when you're starting to be in your 40s, 50s, 60s. You're seeing these diabetics earlier and earlier. I do want to circle back, though, because you mentioned gestational diabetes.
Sure.
So let's just talk briefly about that and why that's so important to control.
So in pregnancy, all of the hormones that are there to keep the baby nice and safe have a tendency to increase our insulin resistance. Most women during pregnancy, when that starts to happen, their pancreas just produces a little bit more insulin. Some women, though, while they're pregnant, have a harder time doing that. So the glucoses are a little bit higher than they should be. And our concern is for the baby, because that higher sugar, that higher glucose, crosses through the placenta and the umbilical cord to the baby. And the baby has a healthy little pancreas, and the baby keeps their glucoses where they should, but they're being exposed to more glucose, sugar, than they should be, and that can make them grow a little bit bigger. So we're concerned about the babies.
Yeah, so I do recall that from those days of taking that blood sugar test.
That
also,
test is so important.
Drinking the stuff.
And women who have had gestational diabetes have a much higher risk of developing type 2 diabetes in their lifespan.
Okay.
So if you've had gestational diabetes, making those lifestyle changes to prevent diabetes is so important.
So it's another risk factor, really, that
It
we
is
need to be
another risk
cognizant
factor.
of.
Yes.
For women who have had gestational diabetes.
Correct.
So, well, Kathy, this has been so informative. And any other words of wisdom you want to give to our guests who are thinking, oh boy, I better go see my doctor?
You know, little changes are so important, small steps. It's not all or nothing. You know, it's thinking about 85% of the time making really healthy choices, and it's okay to have that little treat. That we had Halloween this past weekend, and there were wonderful treats there. It's having one fun size of whatever your favorite candy is, and then, you know, Monday, going back to those healthy eating habits. Same thing with the upcoming holiday season. I would never tell anybody that they shouldn't have so-and-so's famous, I don't know what this most amazing, delectable dish is. But if it's one of your favorites and it truly means that that's part of the season for you, by all means, you have a little bit of it, a really small serving. Have a couple bites, savor it, enjoy it, and then done till next year.
Well, that's great. And it's great advice, and it's a great reminder for all of us that we have to be mindful. And also that I like your message that it's very positive in the sense that, yes, if you've been diagnosed with type 2 diabetes, it's in our control to reduce the risk to our bodies. And so that's a really positive message that we have, if we're mindful, that we can take this into our own hands.
And we talked a lot about all of those terrible things that can happen. I remind people, complications happen, poorly controlled diabetes. Our goal is always to try to control it, and hopefully those terrible complications won't happen if we do a good job controlling it.
Absolutely. Well, thank you so much, Kathy, for joining us, and keep up the great work.
Thank you, Jane.
I love hearing about this stuff, and I look forward to us working together a little bit more as we get our community health improvement plan
That would
in
be
place.
wonderful. I am looking forward to that as well.
Thank you. And thank you for joining us on Public Health Matters. Hope you guys have a great week and stay safe out there.
Small steps, big difference. Preventing diabetes is within your reach. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. More than 1 in 3 U.S. adults have prediabetes. That's 88 million people. But most don't know they have it, and there are usually no symptoms. People with prediabetes have a 50% chance of developing diabetes over the next 5 to 10 years. But making healthy lifestyle changes can make a difference. You can prevent or delay type 2 diabetes, and you can even manage or reverse your prediabetes. Try to get at least 30 minutes of physical activity 5 days a week. Start slowly and build up to your goal. Consume healthier foods and drinks most of the time. Choose foods that are high in fiber and low in fat and sugar. You can also try smaller portions of food. Lose weight, track it, and keep it off. NIH studies show that losing 5 to 7% of your weight can help reduce your chance of developing diabetes. Work with your doctor or healthcare team to manage your prediabetes and improve your overall health. Stay up to date on vaccinations. Vaccines can help you stay healthy. Healthy lifestyle changes taken in small steps can make a big difference. Preventing diabetes is within your reach. Visit niddk.nih.gov to learn more.